Good morning, everybody. I'm so glad that you guys are able to join us. Today, I want to introduce you to Helena Wagner with the Head Start Collaborative office. She is going to talk to us about what Head Start in Wyoming looks like and our close relationships at the federal level and how we can work together to make sure that all of our clients are getting the high quality level of childcare needed for their families. Helena, I'm turning it over to you. Thank you so much for joining us today.
Can you all see my screen?
I can.
Effectively? Oh my gosh, I don't think I've ever done that. It moved over to my second of 3 screens, so I apologize if I'm looking over this way a lot.
We are actually seeing your presentation screen.
Okay. Yeah, I sometimes think that's a little easier.
Okay,
as long as mode.
Nope, no problem.
Because usually it goes into the strange format. So I won't keep you guys any longer on this. I appreciate you having me. This is a really great opportunity to actually, I think it's mutual for me to share information, but this is also a chance for you to kind of tell me what you know about Head Start in the communities that you are living in and serving. So hopefully for most of you, this is more of a refresher than an introduction, but I will have some pieces that are a little bit more geared towards an introduction to Head Start as a whole. But most of my focus will be on kind of exploring some of those existing partnerships and finding maybe some new and innovative ways to partner with your local program as well. So I like to start with my business card slide. So I am the Head Start Collaboration Office Director, and I like to think it's probably one of the rarest jobs in the United States. There is one collaboration office per state, and then there also is a collaboration office specifically for tribal programs and for migrant and seasonal Head Start programs, which are really neat. But we don't have any in Wyoming anymore. We used to, but they're reserved for populations that have a really significant influx of migrant and seasonal workers, and they are a 10-week program that are specifically geared towards cultural and language needs as well as development. So anyway, currently, I am housed in the Wyoming Department of Workforce Services. I am also kind of the rare bird in the sense that I'm a state employee that's connected to Head Start, but it's just me. And I'm in the process of potentially moving to the Department of Education. It's a question that I get frequently, but at this point, there is some budget legislation that has proposed the move. So if that happens, it will be in July.
Helena, I have a quick question real quick. I know when I saw the assessment that came out from the attorney on that PDG, and there is that discussion about kind of housing everybody under the same roof. Is that part of that same discussion?
Sort of, yes.
Okay.
I think I will say that the collaboration office is related to the Head Start Act of 2007. So any state that has a Head Start program at all or receives that funding is required to have a collaboration office, but it's up to the governor to decide where it goes. So it's meant to improve alignment across systems, and that's why the Department of Education was proposed. I think with some of the federal changes, it's probably a good preemptive move anyway, because we'll have to do a lot of coordinating.
So in the state of Wyoming, we have CDC's under Department of Health, we've got the Department of Education, and then you're in the Department of Workforce Services, and they're just looking at kind of streamlining some of that.
That's the goal.
Okay.
We know we have a lot of gaps in how we provide early childhood services. And a lot of it too is philosophical, because you have folks who are really oriented towards development, and then you have the academic side of it, and sometimes they clash a little bit. So,
gotcha. Okay, thank you.
You know, it's also my job to navigate some of those challenging waters, but I'm from Wyoming, so I'm not really surprised by most of it. So I think that's prepared me. In my role, I act as a liaison more than anything else. Like, I am a connector and hopefully a source of knowledge. I am involved in a lot of systems work. So, I kind of dip my toe in the waters of medical and education and workforce needs. So I'm all over the place. But I like to think that it's also a really good resource for people who need to know how to connect to others, because I'm in a lot of conversations that I had no idea would be connected to Head Start or anything related to early childhood. So I think just to give you an example of that, there's currently an initiative to start a Plans of Safe Care program in Wyoming through the Department of Family Services. And it is meant to provide some safe alternatives for infants, and I guess, mostly infants who are exposed to substances at birth. So the goal is to provide both a humane option for mom and baby. And of course, Head Start has a role in that because there's a lot of trauma training and support embedded in Head Start programming. But we're finding that a lot of the stakeholders kind of fall outside of the early childhood realm, and maybe include law enforcement and other providers, especially with mental health. So finding those pieces is sometimes a challenge. And I think that it kind of embodies what the Head Start Collaboration Office is. I don't have any regulatory authority over Head Start programs, thankfully, because it's a pretty extensive system that they have to work under. I don't represent any single Head Start agency. Those are all local programs, and they have complete governance over what they do, aside from the regional office of Head Start and the national office of Head Start. So I work with them, not for them and not over them, I think is the main point of confusion that I usually see when asked about my job. But I'm kind of I'm not really the priority for this discussion, so I probably spent too much time on that one.
I do want to tell, I don't know if you have moved slides. We are still seeing just your cover slide.
Oh, really?
Yeah.
Okay. Well, thank you. Okay. I don't have any notes. Can you see that?
I can't see your notes, but I can see your presentation screen. And I see your slides off to the left-hand side of the screen, and we're still on the first one, is what I'm seeing.
Oh, that's because it paused.
Okay.
It moved over on me. Okay.
There you go. Now we're moving. Thank you.
All right. So there's my slide, and it's all in this. The nice thing about slides is you can always go back to it and don't have to worry about notes, right?
Right.
So let me just really quickly go over the brief history of Head Start and of how they operate and look today. You will find a lot of parallels to programs that came out of the War on Poverty legislation in the 60s. Of course, all were geared towards reducing poverty rates in the United States. And Head Start specifically was meant to address generational poverty by reaching our youngest and most vulnerable population. And that continues to be at the heart of what Head Start does. But in addition to serving children, there's a significant focus on families and caregivers of young children, because they recognize that if you're going to break that cycle of poverty, children need support, and parents are the most important piece of that. And sometimes they need help too. There are Head Start programs in every US state and territory. And as I mentioned earlier, there are some specific programs for the tribal and migrant populations. Okay, so I think that the connection between community action agencies or other recipients of the community service block grants and Head Start is really fascinating. It, of course, was a partnership made on purpose. Many community action agencies nationwide host Head Start programs. I don't recall exactly where I saw this number, but 1,024, right? That's a pretty high percentage of Head Start programs. In Wyoming, we've had some programs that we're very closely affiliated with community action agencies in Absaroka. So I guess Central Wyoming, they originally started as a community action agency as well. So there's a long history with that. And the focus hasn't shifted that much to being community oriented in programming. I said it's really about providing tools to self-sufficiency and providing some of those really essential developmental services as well for young children, especially as they're getting ready to head into the traditional K-12 setting. Okay. So the eligibility piece is, for me, the best bridge for referrals and collaboration. Right? A lot of services in our state are very much word of mouth, reputation based, and that's still true, and that's true of Head Start as well. There are some federal requirements because it is a program that's intended to serve the most in need in any community. There's an income requirement of 100 to 130% of the federal poverty line. There are some exceptions to that. If a family is experiencing homelessness, their income does not matter. And if and at least 10% of slots must be reserved for children who are eligible for IDEA services. I can tell you in Wyoming that typically anywhere between 10 and 50% of classroom slots are filled by children who are also receiving special education services. So they had to be pretty well versed in providing a diverse set of supports for children. And then of course, because of that income eligibility, there's a pretty good chance that a family is also eligible for other benefits such as TANF, SNAP, and WIC. And so those are great conversations that can be had either by the Head Start staff, or alternatively, a family can be referred to Head Start if they have a child from birth to 5. And I'll discuss that distinction here in a minute as well. The other piece of it, when a family starts at Head Start, they are screened pretty extensively. They have an application packet that would also identify potential services that they would be eligible for, especially with housing. And just so you know, the McKinney-Vento Act is what Head Start programs use to identify homelessness. And none of them ask, are you homeless? On the application, they typically identify based on a list of housing options, so they could kind of reduce some of the stigma. And they also do checks on where a child is at with their medical checkups and dental checkups. They do referrals to providers if the child needs immunizations. Or other, I always get the acronym wrong, EPSDT, the periodical screening, is that what it is? Something like that. You know, and they also work with providers to bring in services to facilities whenever possible. So, you know, the referral system is very important to the Head Start staff. Which typically include, of course, classroom teachers and support, but also family engagement specialists, health specialists, and special education folks. So
Elena, quick question. In community action, we have been moved up temporarily until we have our full reauthorization bill signed to 200% of the federal poverty line for qualification. Is Head Start talking about raising their qualification or income guidelines for families due to COVID?
I don't think so.
Okay.
And I'll tell you, I guess the other part of this, why it's really important for programs to track this, is because a lot of families wouldn't necessarily self-identify as being eligible for certain things. I know, for example, that up in Jackson, there's a huge problem with this because the federal poverty line does not reflect their local reality. Poverty means something very different in Teton County and Sublette County as well. But quite a few families are cohabitating, right? So they would technically be eligible for services because they would be considered homeless under the McKinney-Vento Act. So, finding some of those nuances is kind of the trick to navigating. But ultimately what it comes down to answer your question better, Susan, is that a Head Start program should be intentionally designed to find those eligible families. And that's what it comes down to. They have to do the work to find the families. And it sounds almost mean, but there's a process in place that is meant to kind of protect that intention. And they don't have a lot of leeway unless there's something that kind of catastrophically happens in their community. So I don't know if that answered it or not, but I don't think they're allowed to make exceptions, but enrollment is one of those where they have to be really on top of it because it's mission driven. So I think it's really important to highlight that despite its federal connection, Head Start is really a local program. It is designed to meet local needs. Which means, again, I'm a liaison. There are no funds whatsoever that come from the state of Wyoming. And therefore, there's no state overreach or not overreach, oversight, sorry. And there's nothing that really inhibits this community orientation for the design of a program. Quite a few are actually designed with specific populations in mind. And it's based on family input. For example, quite a few of the Head Start programs, so the preschool mostly population, they have a 4-day week and they operate along a similar calendar as our schools because that is what parents most prefer. That deviates quite a bit from what is going on nationally, where you have quite a few year-round programs, for example. And they have that option. Even in Lincoln-Uinta County, they have kind of an older model of Head Start where they have several days in the center, but then teachers also do more home visits for that older population. You also see some nuances in how we do early Head Start services, which is birth to 2 and includes pregnant women. Most of those are actually home visiting programs. A few provide that infant and toddler center-based care, but most do the home visiting model at the moment. And that actually is where you would see the most change. When they do have some challenges with enrollment, programs can apply to switch Head Start slots to early Head Start. And as you have more local preschool options, quite a few are actually seeking to add more infant and toddler slots to their programming. So they have a lot of options, I guess, to be flexible, but they're still expected to work with the income requirement. The other piece of this is that Head Start is, and I guess you guys can probably relate to this as well, but Head Start has the option of engaging in community advocacy and state advocacy, and of course, national advocacy. Before we started recording, we were talking about the Build Back Better plan. And the National Head Start Association has been very involved in that work. And that's pretty rare, I think, for a federal program. But they are also a very good resource because they are speaking on behalf of the families that they are serving. And that's often a voice that is missing from various policy related conversations. So if you need some of those voices, reaching out to a local Head Start agency is a potentially good option for you. Okay, so of course I have a map. You probably can't see the key very well if you have the boxes on the side, but what you can see is that we have Head Start programs in a pretty high percentage of Wyoming communities. And quite a few are kind of co-sites. So they include the Head Start as well as the Early Head Start programs there. Again, for some places, and I'm looking at Lusk and Guernsey and the most rural of the rural, Head Start is the only childcare provider in town. So they have changed their model a little bit because quite a few also have other funding sources. They have changed their model to be able to support children who are not officially eligible based on income. So to give you an example, in lieu of trying to explain something that's kind of complex, in Lusk, they provide the traditional 10 or 15 slots for Head Start eligible children, but then they also provide the Child Development Center services. So that is specific to children who qualify for IDEA services. And then they also provide slots for private pay. But the children are still receiving the same evidence-driven curriculum and the learning opportunities. So they have adapted to what their community needs are. And they're usually on the forefront of that effort, which I think is important to note when you have some conversations about reaching children and really providing access to childcare. So, okay, so I like to include a little bit of a profile. So just for the record, and I'm going to say this a few times, Head Start has to collect a lot of data all the time. But for states like Wyoming, it is the only data that we have on our population related, especially if they're lower income and for younger children. So I think it's really fascinating, and I don't really know how this compares nationally, but 20% almost, I think this year it's technically 18% of children under the age of 5 are enrolled in a Wyoming Head Start program. That's about 2,000 kiddos every year. That number doesn't change too much because it's funded enrollment, but they also have to do some private fundraising and things. So they kind of exceed those federal funds. And then, of course, most are qualified based on meeting that 100% of the federal poverty guideline. But I'm assuming the bulk of that are folks who make a little bit more, but don't exceed 130%. And then you do have some of those exceptions that come in the other forms, right, through homelessness, foster care, and disability status, right? So, in the last few years that I've seen, I've only been in this position for a few years, so I guess I have to keep that perspective in mind. But the number of families and children who are identified as experiencing homelessness has changed because how they ask that question has changed. But they are seeing some higher rates across the state. And I share this information pretty regularly with the Department of Education and their homelessness coordinator. homelessness education coordinator, excuse me. So we do what we can to identify where these needs are. And we really look for that family perspective as opposed to what you might stereotypically think of as somebody experiencing homelessness. So if you're trying to identify where the families are, reaching out to either your Head Start or your school district might be a good place to start with that. Of course, almost all children are eligible for public assistance, and I would say the vast majority are currently enrolled in at least Medicaid. But of course, you have SNAP and WIC, and some families choose not to enroll in those services, but it's not from lack of trying from the Head Start staff to get them connected. Again, that 20% of enrolled children are eligible for services for a specific learning or physical disability is higher than the national average and higher than the national requirement. And I think it also speaks to the increase in support needed for the staff at these centers, because the combination of working with children who have just experienced a lot of adverse circumstances can be pretty mentally draining. But then of course you also have the family, and you could look at this two ways. I think you have some high percentages of families that are headed by a single parent, but you also have a pretty high percentage that are headed in that traditional family model. And you have 68% of participating families that have at least one adult in the workforce. So I think those last two bullet points alone kind of shatter some of those stereotypes and stigmas that we have about families living in poverty and their investment in their children. So I guess that was my little bit of advocacy there. Okay, so in addition to child development services, of course, there is a comprehensive model, and comprehensive really means comprehensive. And of course, they track the data and the number of families who are accessing these supports. Typically, the highest services that are sought are the emergency and crisis intervention services. And of course, as we know with families in the highest need category, they usually are facing that at the last possible moment. And so Head Start staff, of course, are pretty well versed in where the resources are, and they do their very best to help connect. And they are also a trusted source. So I think it says a lot when you have a family who is extremely vulnerable and preparing to manage a catastrophe, and they go to these, staff at their Head Start program to ask for help. I think that speaks a lot about the level of trust and partnership. Housing assistance is a pretty big one. I think usually they do referrals in those cases to either the Department of Family Services or whatever community resource center is available that has the applications for it. Of course, navigating that can be challenging. But on top of that, they do frequent, classes, for lack of a better word, in asset building and financial education. Mental health services are really in demand at the moment and are a high priority. Of course, you have substance misuse prevention and education. English as a second language training, again, for adults, but quite a few programs, when they have a high ESL population, they incorporate that into their curriculum. Parent education, so that can vary from domestic violence prevention to what to do when your kid is having a tantrum at the grocery store, right? Those are some basic parent education examples. And then there's also education on medical, oral, and nutrition health, I guess. And they help link education opportunities and job training opportunities to parents who are seeking it. And historically, this is less of the case now, but historically, Head Start has also prioritized hiring parents to work as staff in their facilities. And there are quite a few really awesome success stories of folks who start out as Head Start parents and then go on to be, a higher level person, or a manager, a teacher, right? They get their degrees, they get their education, and Head Start has the funding and the other resources to help facilitate those efforts. You don't see it as much anymore, I would say, but there's still a pretty high percentage, and they still ask, on the data collection that they have to do federally, they still ask how many parents are currently employed by the Head Start program. The challenge, of course, is that the wages are still very low. So it's not necessarily going to lift anybody out of poverty immediately, but it's a chance to really sharpen some of those parenting skills and provide a career ladder for folks who might be interested in education, right? So here's the part that hopefully is maybe new for you. Because services are comprehensive, there's a huge reliance on community support. And it, again, is based in you can see it in the structure of a Head Start program, right? The board for each program, I should say, grantee, is meant to be comprised of experts who can provide financial advice, legal advice, things that kind of are necessary for a strong organization, financially and in terms of work, actual program organization. But also, these are folks who can lend some credibility and ask for kind of help and be the voice of Head Start in their community. Right? Volunteers are always really essential because there are two reasons. One, there's usually something to do around a site or in a classroom, but there are also it's also allowed to contribute towards the in-kind match that a program can use to maintain their federal funding. Right? They have to, I don't know what the percentage is, but these guys have to go out and fundraise or use in-kind services towards their match, right? These grants are sometimes over $1 million. And so that's a lot of money for them to collect at the local level. I don't know if that made sense, but you can ask follow-up if need be, right? Volunteers are also, it can be a good professional learning opportunity, especially for students who are interested in becoming teachers. I personally think that they should spend a little bit of time in a classroom before making that career decision. And quite a few of the local programs, open their doors to high school students who are making that consideration. Of course, folks from dentists' the offices and other healthcare facilities come on site and do basic checks and education. Here's how to brush your teeth. Here's how you wash your hands. And another partnership, I guess I can cite Sensible Nutrition here. They do quite a bit of work with families as well because they have that income requirement. And they work with kids on how to maintain those healthy eating habits and hand washing and germ prevention, which in a preschool setting is pretty much impossible, but they try. So then I went through and I pulled some examples from actual sites. And, of course, this one caught my eye because it's geared toward, it's examples of a few partnerships in action. It's geared towards mental health. The pyramid model is actually a trauma-informed, evidence-based model that they use in quite a few classrooms. But to take it to the parent really helps drive that connection between what the staff are using and what parents could use. They also bring in an expert. His name is Mr. Mack. I don't know if any of you know Mr. Mack, but he is a local, I think he's in Cheyenne, I believe, but he travels in a huge portion of the state and he provides mental health services for children. And he's one of the few that do it. And he's also one of the few men that do this work as well. So he's a great resource for modeling what it means to be supportive to a child's need and responsive to behaviors. But he's also present in these classrooms. And I think maybe a little biased, but I think it's a great way to bridge that, right, and illustrate the approach. Okay, the in-kind, again, it can be time committed. I like this picture for a few reasons. I have definitely painted a few curbs bright yellow. And so this just took me back to some of the volunteer work I've done in Head Start over the years. I grew up next to a building, and my mom worked there too. So I was recruited, and it was not a problem for me. But there always are little tasks to be done, especially with facilities maintenance, snow removal, handyman work. They are not terribly picky as long as you don't break anything more than it already is. They would probably be okay with it. Of course, within in-kind as well, you have donations for food, clothing, toys, books. Right? There's usually a need. Information sharing is big. Most programs use like Facebook. Some use texting services. So I guess the other side of this is if you have surveys, your Head Start program might be able to disseminate your survey to families because they're probably eligible for services if there's an income requirement. But quite a bit of the kind of federal messaging around the census and the child care tax credit or the child tax credit, they've really looked towards Head Start and similar programs to share that with families because it sometimes has to be delivered in a way that families are going to be able to access it, right? Whether that's in saying, hey, this is a trusted source of information, or even doing things like translating. The other piece that comes from Absorca is the social emotional training for families and caregivers. So this is actually a program that came about because of the preschool development grant. There's a pretty big mental health component to that as well. And so they brought in a couple of experts to really do some intensive kind of trauma-informed and systems level work in Wyoming, including for parents. So officially, Why Kids First was the host of the social emotional training, but they reached out and worked with Head Start programs to share that across social media settings, posting flyers and whatever else they needed to do to get that information out there. So, okay, and then of course you have kind of the traditional education-based programming, right, which is going to, I think Jackson has a lot of these, right? They work very closely with their literacy, with the literacy program, with the museums, with the resource outreach. But of course, it's a chance for education. It's also a chance for really engaging adults in how their children learn and showing them these kind of non-traditional, or these, I don't know that it's non-traditional, but showing that there are ways to be involved in the learning experience outside of the classroom, right? You don't have to be an expert on teaching a child how to do math, but you can take them to the museum and do a STEM project with them, right? These are kind of the fun field trips, right? They're also great partnerships. And then, of course, I had to follow the fun pictures with another wordy slide, but if you're looking for another partnership opportunity, asking questions and having conversations about data is one of those. You all might have to do a community needs assessment too, which I guess is a good thing because sometimes
we do every 3 years though is when ours are required.
Well, then maybe the Head Start program should go to you guys and ask for information. And they have this matrix that's about 20 pages long, and there are some required pieces of it like demographics, but there are a lot of pieces that are hard to find information on. And as a state, we don't really collect a lot of it because our populations are small, or at least we don't share it. So it turns into a team effort in finding some of this information. But if you all have to do a community needs assessment, and this is in my opinion anyway, connecting on the data pieces and the sharing is a big time saver. It also helps start some conversations about other ways you can partner, right? So that's my own, like kind of plug. I also have to do a needs assessment, just for the record, but it's not as interesting in terms of the actual data. It's more on how well are people partnering and collaborating, and where can I help bridge the gap, right? So the data is out there. I said it's also a great way to connect to families is through the folks that they tend to trust quite a bit, which are the Head Start staff that walk into their home and provide services, or reach out and make sure that they have food to feed their kiddos when everything is shut down for COVID. Right? Those are roles that programs play. Right? They also can transport families for things like medical appointments. They can help set up appointments, but keep in mind the approach is to help them gain those self-sufficiency skills. So they will guide and teach, but the goal is to help that family really gain that independence and advocacy skill. So, and then I forgot about this slide, sorry. The Early Childhood Learning and Knowledge Center is, and this is where I'm going to add the links as well. It can show you the actual physical address of a Head Start in your community, but it also provides a lot of general information about supporting children in development and family engagement, and really anything that is remotely connected to Head Start. There's a ton of information about it on the Learning and Knowledge Center. Of course, you can always reach out to me and I can connect. And then there also are these pieces of national, like they are, again, probably something you're very familiar with, which are National Centers of Excellence. Head Start has their own TNTA system. And, again, family engagement is one of those things that, again, you probably have access to and know about. But they're great resources and they are taxpayer funded. So as long as that's the case, they are readily available to the taxpayers, right? Which would be your programs and the services you provide as well. So lastly, I wanted to say thank you. I'm in a state office and I don't really do a lot of, the hands-on work, but I have in the past and I loved it. And I know how impactful it is, whether or not, families are in the moment and realize that now. So thank you for what you are doing out there in supporting some needs of families in probably the most adverse conditions I've ever seen. So, I appreciate your commitment, and I'm sure a lot of folks do as well. So with that, I think I have a few minutes for questions, or if you just want to share a good Head Start story, I'm a fan of that.
Helena, this is amazing. Thank you so much, because as much as I thought I knew about Head Start, I don't think I did, because when you started talking about all the different referrals and the services that they're offering families, I thought of Head Start as just another school. And it's not. It is so much more. And what it means to families being able to be connected to their community is enormous, because we know that one of the protective factors is a sense of belonging in your community. And this just sounds like such an incredible natural partnership with community action that I can't believe I don't work closer with my local Head Start programs. This has just been so eye-opening for me. Thank you for showing me more about this. It really makes me feel like I need to get on the phone right now and be like, I need to have way better connections than I do.
I appreciate that. There is a lot of information and there could have been so much more. So hopefully I was able to do more of the snapshot version of it. It's an extensive program. It's when it's been around for decades, it also happens to be very well studied and evidence driven. So, so I think it creates this problem where there's almost too much information, but it does allow me to kind of pick and choose what might be the best fit for an audience. So
community action is data driven and has all of these resources and all of this. When you talk about the data, we're all about results and outcomes and all of this data. And that's something that we talk about a lot as an organization. And it's just to know that there's another partnership in our community that we can to collaborate with that's important. That is really important. My heart is breaking for that eastern part of the state, though. There wasn't very many dots over there.
Let me go back to the map. They're pretty well covered.
Okay.
The lack of dots, I think, is related to the lack of people.
Okay.
Yeah,
because I'm like, I see Gillette and Lusk, and I'm like, oh no.
Mm-hmm. I believe there is this Early Head Start in Moorcroft or something, but they do have a child development center up there. So I think at one point they had more. Wyoming Child and Family Development is the grant holder for literally the entire eastern half of the state, minus Laramie. Okay. But they reduced services in some areas because the Child Development Center was already meeting the need. So that was a while ago, but they talk quite a bit amongst each other in the early childhood circles. But yeah, I think we're good. They have one in every state or every county and every community that has children, I should say.
That's good to know. I think we fall under where I'm located, and I never know if it's Absaroka or
it's Absaroka.
It is Absaroka.
That's what I also learned in my first.
Okay, so I am through where I live, we're Absaroka, and we're in that area right in there, and they just do tremendous work. So I'm in Sheridan, so Sheridan and Buffalo, and we have a new Head Start facility, which is amazing because we're now able to meet the demand of all of the kiddos who can benefit from Head Start. We were in serious physical capacity issues.
Yeah, I have heard about some of those, and I am really excited that Sheridan has a new facility. Is it all their own or?
Yeah. It is. They built a brand new 2 classrooms, the kitchen, playground, parking lot area. It's beautiful facility, and they received some federal funding to make sure that they were able to make that happen. And I just look at, because not only am I with CSNO, I'm also with a community action agency that provides self-sufficiency services, and it's just like, what a good feeling to know that we're not doing it alone, that there's a good partner to work with on that.
Yeah, I'm sure they're really relieved about having a building, because that was definitely a test in collaboration, is finding the right place to have this service, because there are all these other requirements. This is a bit of an aside, but all but one Head Start program are licensed. So they have to meet some pretty strict standards in physical location for safety and health reasons. The only program that isn't licensed is affiliated with the school, so they do not need to be. It is a perfectly safe place, but I think it adds to the layer of complexity that they put themselves through when they are licensed as well. So yeah, the childcare piece is really great, but it's so much more. And I think that's the biggest takeaway from Head Start. And one of my favorite things about it is that it takes a village mentality in action. And the more I've learned about community action programs, the more I've found that to be the case for your programs too. So
it really, really is. So before we let Helena go, I would like to open it up for any questions that you may have. Jane, I know you were able to join us today. Michelle's here, Anel, Jackie, Aaron. We will be making this video recording available to everybody who registered. But in the meantime, if you have any questions, or Helena, if you need anything from community action and how we can also help the Head Start programs have a better understanding of how they can partner with community action, please let us know. We would love to be a part of that.
Okay, actually, and I can reach out to Erin for this too, because I see she's on the call, but sometimes just having the list of affiliated programs is really helpful, because when you have staff turnover and things like that, it can vary. And there's, that's probably the hardest part with this work, is that information is lost when you have one person who's in charge of something, right? And they take a different job or retire. So preserving that information would be really good. And then eventually, it might be worth a while to do kind of an overview too with the Wyoming Head Start Association at one of their meetings down the road. I'm not sure
happy to.
That's time for them, but maybe in the spring or summer.
Yeah, let's get them through enrollment real quick.
Yeah, yeah. I think just sometimes it's good to have that refresher, but in the meantime, you can always reach out to your local folks if you don't already have that in place.
Jane, did you have a question? I saw you took yourself off of mute, so I was wondering if there was something you wanted to say.
Yeah, my question was going to be is one, you mentioned the map and all the different addresses and locations. Is it possible to get a copy of that? Only just so that we can, for, me database wise, can make sure that we have every location, which I'm pretty sure we do, but just a double check, it wouldn't hurt.
Yeah, in addition to the PowerPoint, I can pull a list, because sometimes that does change and their addresses do change. So I can pull that information and put it into a nice little directory for you.
Thank you.
That would be helpful for me too. I did put one together kind of just at the very beginning to say, at least I know where they all are. That would be very helpful to have an active list. And Helena, I will share our list with you as well. Make sure that you have our grantees. I don't necessarily have the full sub-grantee list, but I do have the 15 grantees serving all 23 counties.
Okay, yeah, I will. I'll report to the association that I did this presentation and use the pictures from their Facebook pages, but whoops, I probably should have done that first. But I'll share that with them as well, because I think that's the biggest part of this is connecting. So
yes, thank you so much. You guys have Helena's email address. It's sitting there on the slide that we have in front of her. I will be sending out the PowerPoint. She's going to put some links into the PowerPoint that you guys will be able to research or to use as resources. And she has been so responsive to any questions that Erin and I have ever had about learning more about Head Start and really making connections necessary so we can do the best for the individuals and the families and the communities that we're serving right now. Helena, thank you so much. I am so grateful for you coming to join us today. And I am going to say goodbye unless there are any final questions.
Okay. Thank you. Happy holidays, everybody.
All right. Happy holidays to you guys.
Thank you,
Bye-bye.
Helena.